More than 800,000 people die of suicide every year, and 100,000 of them are citizens of Indonesia. Based on the data from National Health Research in 2018, mental health in Indonesia is still far from ideal. More than 19 million people aged 15 years and older develop mental disorders at some point in their lives. More than 12 million inhabitants over the age of 15 also experience depression. The data from Years Lived with Disability, or YLD, states that Indonesian people suffer from depression, anxiety, schizophrenia, bipolar disorder, behavioral disorders, autism spectrum, eating disorders, intellectual disability, and attention deficit hyperactivity disorder, or ADHD. On top of that, depression has been ranked first as the mental health issues most experienced by Indonesians. So, what's causing this? Having more than 1,300 ethnic groups, Indonesia is known as a country rich in diverse cultures and beliefs, entrenched in day-to-day life. This can mean that some people believe mental health disorders are caused by lack of faith or supernatural reasons. There are those who believe people with schizophrenia are suffering from dark magic, demons, unclean spirit, and other non-scientific reasons. With this stigma, the community handles mental health problems the same way it's coming from a non-clinical solution. The number of mental health workers in Indonesia is also still relatively small. This contributes to how little help is available for everyone who needs it. Based on the data from the Ministry of Health Research, we currently have 25,000 clinical psychologists and 600 to 800 psychiatrists in a population of 270 million. That means about one psychologist for 108,000 people. An impossible task. The distribution of psychologists and psychiatrists is also uneven and concentrated in Java Island, with the increase in cases of mental health reaching 7 to 10% per year. Moreover, mental health service availability or access to information about mental health in Indonesia is also inadequate. As of 2018, Indonesia has only 48 mental hospitals in the island of Java as our mainland. This is why the pandemic of COVID-19 eventually became the catalyst that had a major impact on the mental health of our people. In April 2020, the Association of Indonesian Psychiatrists conducted a survey about the impact of COVID-19 on our mental health. This survey was conducted online with as many as 1,552 participants scattered on the island of Java. As expected, this survey shows 63% of participants reported anxiety. 66% claimed to feel depressed, and 80% had symptoms of post-traumatic stress due to the horror of COVID-19. This figure might increase for the remaining 2021 given the number of cases continues to grow with the discovery of a new variant, which forces communities to return to face their trauma again. Reportedly from the data, starting from April until August 2021, 64.8% people battled with mental health issues from 4,010 participants. Then, what can we do? Established in 2015 by Audrey Maximillian, Riliv aims to provide access to better mental health for Indonesians. This commitment continues to run and is evidence that during the pandemic, Riliv helped resolve more than 20,000 people who have mental health problems, which increased about 500% since the pandemic started, based on our internal data. In order to provide more help, Riliv will continue to provide counseling and self-care activities for citizens of Indonesia, especially regarding mental health issues that arise due to COVID-19. Although still far from ideal, this is our fight for mental health in Indonesia. Riliv is expected to be the answer to the needs of the mental health community and a better Indonesia. Because we believe there is no physical health without mental health.